Good afternoon. I'm Dixie Woolston. I'm a neuropsychologist. I work at Mayo Clinic in Arizona. I'm going to be talking with you today about how to optimize brain health for vital longevity. As I said, I work at Mayo Clinic Arizona. One of my roles is I am the chair of the neuropsychology division and also the chair of our neurohealth team. One of our big projects last year was to work with our executive population. So these are individuals between about 30 to 65 that are CEOs of Fortune 500 companies all over the world. And one of our big pushes was to work with them on their brain health. So I'll be talking a little bit about that. This is our team. Mayo Clinic's primary value is the needs of the patient come first. So I always include patient as being a key component of the treatment team. And then I work with Cynthia Stonington, who is a neuropsychiatrist, Andrea Kook, who is one of our therapists, then Donna Locke, also a neuropsychologist that works in the space of cognitive rehabilitation for mild cognitive impairment, and then me. So this crowd doesn't need any education on brain basics, but I love the human brain. So I always like to start a presentation with some of the things that I just love about our brain's capacity. So we have 86 billion neurons. We have 1 quadrillion connections. Information can travel 268 miles per hour. You actually use all of your brain, even when you're asleep. And the brain is such an impressive piece of equipment. So it is very important that we take care of our brains. I am passionate about improving vital longevity and increasing optimization of brain health for my patients. As a culture, we are totally fascinated with upgrading our brains. And in the interest of time, I'm not going to show you this clip from the movie Lucy, where she gets, it's a fictional story of what would happen if your brain could actually be used at full capacity, according to Hollywood. And then, of course, Limitless, where Bradley Cooper gets an upgrade of when he takes a tablet a day that makes him fully functional. Science fiction, though, Science fiction, though, is really becoming a reality as bloggers discuss the ethics of smart drugs known as nootropics. Also in the United States, certainly our Silicon Valley population, they are using nootropics daily to enhance their cognitive function. And then there's also, a drive to use different legalized drugs to hack your brain, so to speak. So there's a lot of ethics around the use of nootropics. We don't want to find ourselves in a scenario where mildly electrifying our brains is no longer considered just a personal choice, but is socially and legally enforced responsibility. And that's there's the other side, though, of this argument, which scientists say that we have been doing brain augmentation forever. So from symbolic language to writing, the printing press, mathematics, calculators, we have used tools to record, store, and to enhance our cognition. So just as smartphones and the internet changed how we lived 20 years ago, brain-machine interfaces 20 years from now may enable more intimate and direct collaborations between brains and technology, which will help us with communications and also, as we've heard about today, possibly treating some neurological conditions. Studies actually show that half of us in the United States are using some form of a cognitive enhancer. And marketing studies show that, at least in the United States, there's going to be a significant portion of income that's touted to improve brain health. So the brain health market is projected to reach over 11.43 billion by 2031. This is perhaps fueled by the Silicon Valley promotion that I mentioned earlier, as they promote the use of nootropics. And then, of course, Elon Musk's Neuralink business line that's currently opening for human trials. So in August of 2022, the World Health Organization launched a seminal position paper called Optimizing Brain Health Across the Life Course. And they are calling the world to action to improve brain health. They point out that 43% of children under the age of 5 in low and middle income countries are at risk of not reaching their developmental potential due to extreme poverty and stunting. So financial losses alone for this missed developmental opportunity is projected to be around 26% lower annual earnings in adulthood. Of course, very few countries have family-friendly policy protections in place with the aim of safeguarding child brain development. And there are growing hazards from environmental pollutants. The WHO estimates that 99% of all people worldwide breathe polluted air in their ambient environment, which they say is a grave threat to brain development. Of course, one of the most compelling arguments for me as a neuropsychologist to optimize our brain health is that neurological disorders that are led by stroke, migraines, dementia, meningitis, they're the #1 cause of disability globally. So we are anticipating nearly 1 in 3 people will develop a neurological disorder at some point in their lifetime. That means everybody in this room is going to be touched either directly, they will have the disorder, or indirectly, someone that they love will have one. So the brain is one of our most valuable assets, and I just want to talk to you about some of the evidence-based pillars of maintaining and optimizing cognitive real estate. So, of course, one of the things that I think is most challenging in my role as a psychologist is promoting behavioral change amongst my patients. Unlike a medical treatment, behavioral change really involves at least 10 sessions after you introduce a behavioral intervention in order to maintain that. That's extremely challenging to do with patients. It's not as easy as just take a pill or a medication and come back for a 30-day med check. The things that facilitate brain health, of course, exercise is probably the number one intervention to improve your brain health. Again, in the interest of time, I won't share this clip from my colleague, Wendy Suzuki. She talks about the brain changing benefits of exercise in terms of short-term benefits for your brain, but also long-term benefits in terms of remodeling of hippocampal neurons and mood changes and possibly playing a role in delaying some of the neurodegenerative disorders. So exercise, my patients really like her book, Healthy Brain, Happy Life. So I recommend that. The MIND diet is one we absolutely recommend at Mayo Clinic. It stands for the Mediterranean Dash Intervention for Neurodegenerative Delay. So it's basically taking 2 diets. One is the Mediterranean diet, which most people are familiar with, combining that with the DASH diet, which comes from the American Heart Association. The DASH diet emphasizes reducing red meats and sodium, fast foods. This combo diet was developed at Rush, and basically they found that people whose diets closely matched this had about a 53% lower chance of Alzheimer's disease. So there are also other cognitive effects from the MIND diet, but 53% lower risk is pretty good for a behavioral intervention. Again, in terms of sleep, that is certainly one of the bigger things. And Matthew Walker's book, Why We Sleep, I love his quote that the shorter you sleep, the shorter your lifespan. I'm sure many of us in this room have adopted the mantra of maybe I'll sleep when I'm dead. And maybe many of you have used strategies to minimize your sleep in order to stay at the top of your game. However, sleep is very important. One of the things that Matthew Walker talks about is he shows clips from the classic study with the spider webs, right, where they have the normal spider web and then the marijuana spider web, but the spider web that's most messed up is the caffeine spider web. And so he has a whole section on how caffeine is so detrimental for sleep. Obviously, sleep hygiene is important to get your brain's rest. Again, with patients, it's very difficult to get behavioral change for them. Finally, a couple of other things that are important are social engagement, and we know that adults that are socially engaged, it actually does seem to affect IL-6, which is one of those inflammatory markers. So having a social network where you maintain and strengthen those connections, it can protect your brain. Strong connections can also boost your mood. And then finally, in terms of keeping your brain healthy, it's really about staying cognitively sharp. With our executive population, we start to worry about their brains when they retire. We've noticed there's a very sharp decline in terms of cognitive functioning and retiring. So keeping your brain sharp is one of the main facilitators of brain health. We spend a lot of time with our patients talking about some of their barriers. One of the things we've noticed is certainly our executive patients are very much into herbal remedies, supplements. They're spending a lot of money on that. And one of the things we noticed a trend in our small sample of executives that we looked at earlier this year is many of them are engaging in psilocybin recreationally. And we don't have a lot of data yet on how that might impact the brain. Another thing we found in our population of executives is they have a lot of vascular risk factors, which seem to negatively impact their brain health. And then all the individual motivational factors, most of the time when they see us, they're very motivated to improve their brain health, but none of them have engaged in the coaching that would help get them those 10 sessions of that would be consistent with the research that would help them sustain a lasting behavioral change. So with that, our executive, one of the things that we did was a baseline brain assessment. We used the computerized platform, CNS Vital Signs. We then met with them individually to just really talk about what their facilitators and barriers were for their own optimal brain health. And then we developed individualized strategies for each of them. And then we're hoping that we will see in the next year, after implementation of brain health behaviors, we'll see improvements. This is still very much in the pilot stage, so I don't have data to show this round. But some of the treatments that we recommended for them based on evidence was either cognitive rehabilitation with a speech therapist or an occupational therapist in terms of memory and attention training, most typically. We use computerized training to maximize attention. We encouraged conversations with prescription providers. As a psychologist, I cannot prescribe, but occasionally our workup would show that they had a true attention deficit and might benefit from attention enhancing medications. We also recommended perhaps the supplement Accentrate as a non-pharmacological supplement they could possibly try. And then we suggested either an alpha stim device for sleep. We really trained them in sleep hygiene. If nightmares were a problem or PTSD, we used image rehearsal therapy to try to improve their sleep. And of course, with mood, we had a lot of difficulty getting our executives to commit to something as time consuming as therapy. So we really pushed some of our applications that came out of the pandemic that benefit mood, such as Mood Fit, Happify, Calm, Talkspace, just depending on what their issues were. We would try to get them to engage with an app, which they seem to enjoy. And then if there were lifestyle factors, we did refer to psychiatry to help with reducing harmful substances such as alcohol or recreational substance use. We had them work with an exercise physiologist to really tailor an exercise program for them. As executives, one of the things they really liked was training in TheraBands, because they could take those with them wherever they went and felt like they could get a good workout, even traveling. And then we had a whole vascular program to help with their heart health that include EndoPat and things like that. And so we're hoping as they adequately address some of these factors, we'll actually see improvements in their brain health. And so with time, I'll stop there. I'm hoping in the future to have more of the post-interventional things from our executive pilot study. But for now, I'm hoping that some of you got some ideas on either your own brain health or how to focus on improving your patient's brain health in your own practices. And any questions?